write vocal fold and you're just kind of guessing, but it's the false vocal fold, we can't accept it. Like, we can't even give half credit because vocal fold is a completely different question or answer, right? So our false vocal folds are located superior to our true vocal folds, okay? They help for protection. And then our true vocal folds are found inferior to our false vocal folds. They're the more inferior aspects, and they're actually producing the sound and coming together and moving apart to change the way we talk, okay? Does anybody have questions? That was like really, you've never seen the larynx, and this is a posterior image, so if you have questions about it, you can ask. No, you're all good. Right? Okay. Normally our vocal folds are also covered by like a membranous tissue and epithelium. If you uncover the fold, you'll find the ligaments. Okay, so here in this image, you have the fold with the epithelium still intact, and they've cut through this epithelium to show you the actual ligament. So these are the vestibular ligament and the vocal ligament, okay? On the model, that's pretty clear. On a, like, embalmed larynx, it's a little bit harder to tell, but if you can, like, see the cuts in the mucosa, and you should be able to see the white, shiny lines of the ligament when you're looking at the actual ligament and not the fold. Does that make sense? Okay. So we have muscles of our larynx, and we're not going to dive too far into each of the muscles of our larynx, but we have extrinsic muscles and we have intrinsic muscles of the larynx. Our extrinsic muscles are our hyoids, like our suprahyoids and infrahyoids, that help stabilize like our mandible or our hyoid so that they can assist in speaking. But then our intrinsic muscles are the smaller muscles that we kind of saw on the real image, but you can see like how they're lining all of these ligaments and really close to the ligaments, and they're really tiny, and they're going to contract to change pitch and tone and all of the different sounds that we are able to make. Okay. Any questions about the larynx? None. Are you bored? At least you're honest. Okay. So we have underneath our larynx, we have our trachea. Okay, our trachea is pretty long. It's 10 centimeters long. Well, it says short, but I think that's pretty long. That's like a long tube in the body. Yeah, okay. Anyway, it's short, but I think that's pretty long. It's 10 centimeters long. It's basically like this hole down to where our trachea splits, right, into our bronchi. And we have airway. We also have loosened air, and it clears it out. Found anterior to the esophagus, right, because we know the posterior part of our trachea is like a thin membrane, so that when food is coming down, it doesn't have to push up against cartilage. It's just pushing up a small membrane, right? It connects the larynx down to our primary bronchi, and then our trachea is going to split into its different divisions. It's going to split into two primary bronchi, one right and one left, okay? It contains hyaline cartilage, right, because they're C-shaped